If you have been on prednisone for more than 3 months, if you take it daily for asthma, or arthritis, or autoimmune disease, if you have ever been told to taper slowly, there is a 7-stage ladder underneath your bones, and you cannot feel it. Approximately 10 million Americans are climbing it right now. This is what chronic prednisone does to your skeleton, stage by stage. The first 6 stages are silent. Stage 7 is the one your body cannot answer. Stage 1, cortisol receptor saturation. Prednisone binds the glucocorticoid receptors inside almost every cell in your body. The drug is a synthetic copy of your own stress hormone. Inflammation plummets, the joints quiet down, the wheeze fades. You feel artificially supercharged. For a few weeks, the drug feels like a miracle. The hidden cost begins on day 1. Inside your bones, the destruction has already started. You will not feel it for years. Stage 2, calcium excretion. Your kidneys begin to dump calcium into your urine. Urinary calcium loss climbs 30 to 50% above baseline. Your blood calcium has to stay in a narrow range or your heart stops, so your body does the only thing it can. It pulls calcium out of your bones to keep the bloodstream stable. There is no symptom. There is no pain. A routine blood test shows normal calcium. The bone is paying the bill quietly. Stage 3, osteoblast suppression. Osteoblasts are the cells that build new bone. Prednisone directly suppresses them. The construction crew has been sent home. Osteoclasts are the cells that break bone down. Prednisone does not touch them. The demolition crew keeps working, all day, every day, unopposed. The balance tips. Your skeleton was always being remodeled. Now it is only being torn down. Stage 4 is where the loss shows up on a scan. Stage 4, osteoporosis. Bone mineral density falls measurably. Your T-score drops below -1, then below -2.5. That number has a name, osteoporosis. A DEXA scan would catch this in 5 minutes. 6 months on prednisone can already drop your density 6 to 12%. The window to reverse it is still open here. Almost no chronic prednisone patient gets the scan. The drug is renewed. The bone keeps thinning. The window closes quietly. Stage 5, avascular necrosis. The blood supply to specific bones dies. The femoral head at the hip, the humeral head at the shoulder. The tissue starves where the vessels were pinched off. The dead bone collapses under your body weight. The hip aches. The shoulder aches. You blame your age. You blame your job. You blame the autoimmune disease. 3 to 4% of long-term prednisone patients develop AVN. Joint replacement becomes likely. The damage at this stage does not reverse, even if you stop the drug. Stage 6, adrenal axis suppression. The drug has been doing your adrenal gland's job for years. Your body has stopped making its own cortisol. The adrenal cortex begins to atrophy. The HPA axis goes silent. The hypothalamus stops calling. The pituitary stops answering. The adrenals shrink. You feel fine. You only need the pill. As long as the prednisone keeps arriving every morning, the body looks intact. Stopping the drug becomes dangerous. Stage 7, adrenal crisis. You decide to stop. Or your prescription runs out. Or you taper too fast. Or surgery, infection, or even severe stress hits in the wrong week. Your body demands a flood of cortisol the way it has every day of your life. The adrenal cortex cannot answer. There is no hormone in the reserve. Blood pressure begins to fall. Sodium drops. Potassium climbs. Glucose collapses. This is acute adrenal insufficiency. Hypotension, shock, coma. If untreated, the body can die within hours of a stress event. The adrenal glands should have answered easily. You cannot just stop. You cannot taper too fast. Stopping kills you. The drug took the inflammation. The drug took the bones. The drug took the body's own answer. There is no warning at stage 2. There is no symptom at stage 4. There is no coming back from stage 7. If you have been on prednisone longer than 3 months, ask your prescriber for 3 things. This week, a bone density panel, a vitamin D and serum calcium level, a morning cortisol or ACTH stimulation test. Never stop the drug abruptly. Never let your supply lapse. A slow taper, supervised by your prescriber, is the only safe way down. Carry a medical alert card while you are on it. Send this to anyone you know with asthma, arthritis, or lupus. The next video goes inside a different organ that also forgets how to come back.